The amount of blood ejected from the ventricle in each contraction is dash. Stroke volume. The amount of blood ejected from the ventricle in each contraction is dash. Stroke volume. Which drug kept ready during tensilon test? Atropine. Which drug kept ready during tensilon test? Atropine. Adenosine is the drug of choice of dash. Supraventricular tachycardia. Adenosine is the drug of choice of dash. Supraventricular tachycardia. Which radioactive substance is used to treat hyperthyroidism? Iodine. Which radioactive substance is used to treat hyperthyroidism? Iodine. Dash is indicated for the treatment of diabetic neuropathic pain. Pethidine. Dash is indicated for the treatment of diabetic neuropathic pain. Pethidine. The most common type of hernia in man is dash. Indirect inguinal hernia. The most common type of hernia in men is dash. Indirect inguinal hernia. Huntington's disease is dash. Neurological disease. Huntington's disease is dash. Neurological disease. Anti-emetics with least CNS side effect is dash. Ondansetron. Anti-emetics with the least CNS side effects is dash. Ondansetron. First stage of pneumonia is dash. Congestion. First stage of pneumonia is dash. Congestion. Which condition is contraindicated for the administration of oxybutynin? Glaucoma. Which condition is contraindicated for the administration of oxybutynin? Glaucoma. After bronchoscopy, patient is shifted to what? What should be implemented by the nurse? A return of gag reflex before offering food. After bronchoscopy, patient is shifted to what? What should be implemented by the nurse? Check return of gag reflex before offering food. A serious and dangerous side effect of penicillin is dash. A serious and dangerous side effect of penicillin is dash. Anaphylaxis. A serious and dangerous side effect of penicillin is dash. Anaphylaxis. Which history is most relevant regarding contrast based CT? History of allergy to seafood. Which history is most relevant regarding a contrast based CT? History of allergy to seafood. The most common AIDS associated neoplasm is dash. Kapois sarcoma. The most common AIDS associated neoplasm is dash. Kapois sarcoma. Difficulties in swallowing is termed dash dysphagia. Difficulties in swallowing is termed as dash dysphagia. For a client receiving aminoglycoside antibiotic, nurse should check dash serum creatinine. For a client receiving aminoglycoside antibiotic, nurse should check dash serum creatinine. Gradual sensorial hearing loss that occur with aging is known as dash presbycusis. Gradual sensorial hearing loss that occur with aging is known as dash presbycusis. Defect in which factor result in hemophilia B? Factor 9. Defect in which factor result in hemophilia B? Factor 9. Characteristic symptom in Meniere's disease is dash tinnitus. Characteristic symptom in Meniere's disease is dash tinnitus. In order to prevent atelectasis after abdominal surgery, which instruction should be given? Practice incentive spirometry 10 minutes every hour. In order to prevent atelectasis after abdominal surgery, which instruction should be given? Practice incentive spirometry every 10 minutes every hour. Practice incentive spirometry 10 minutes every hour. Most common cause of angina pectoris is dash blockage of coronary artery. Most common cause of angina pectoris is dash blockage of coronary artery. Analgesics are given to reduce pain. Analgesics are given to reduce pain. Assessment of a unconscious patient is done by dash Glasgow Coma Scale. Assessment of a unconscious patient is done by Glasgow Coma Scale. The lymphoid organ is located in pharynx. Adenoid. The lymphoid organ is located in pharynx. Adenoid. Cause of nephrogenic diabetes insipidus includes genetic. Causes of nephrogenic diabetes insipidus includes dash genetic. Ringworm infection of the nails is known as tinea angium. Ringworm infection of the nails is known as dash tinea angium. The condition in which eye is slightly hypermetropic for red rays and myopic for green rays is called emetropic eye. The condition in which eye is slightly hypermetropic for red rays and myopic for green rays is called dash Ametropic eye. Cause of iron deficiency anemia in CRF is dash. Decreased erythropoietin secretion. Cause of iron deficiency anemia in CRF is dash. Decreased erythropoietin secretion. Injury to the lower trunk of brachial plexus is known as dash. Clumpex paralysis. Injury to the lower trunk of brachial plexus is known as dash. Clumpex paralysis. Which cartilage is termed as Adam's apple? Thyroid cartilage. Which cartilage is termed as Adam's apple? Thyroid cartilage.